So Florida's new Surgeon General wants parents, not schools, to decide if students should quarantine at home or go to school after a possible exposure to COVID-19. We are continuing this conversation this morning now that the state is giving parents the power to decide when their student should return back to class. Duval County Medical Society Foundation President Dr. Sunil Joshi is with us this morning. Dr. Joshi, let's look at what the CDC says. It says people who get infected can spread that virus starting 2 days before they ever exhibit any symptoms. It is recommended that a student should quarantine for 14 days. If they are unvaccinated, it can shorten to a week by testing negative. Now, we know, Dr. Joshi, that children are often asymptomatic. So how many kids could potentially get this virus or be exposed to it if the students are allowed to go back without a quarantine period?
Yeah, and it's going to be a much higher number than I think most of us even realize. Keep in mind that the original variant of COVID-19 had what we call an R naught, which R naught kind of gives you an idea as mathematically as to how contagious the virus is. The original version, one person could typically spread it to between 2 and 3 people before they found out that they were infected and then quarantined. This Delta variant, one person can spread it to between 8 and 9 different people before you end up being quarantined. And so it's a significantly higher number of people that may indeed pick up the virus. So if you have 2 days before you show symptoms, meaning 2 days before you then end up getting tested or end up quarantining yourself, you do have the risk of spreading this to a larger number of people. And if you think about a classroom size, a typical classroom size is between 20 and 25 kids. If one person has the ability to spread it to between 8 and 9 other children, you can imagine how quickly people are going to get infected.
I want to lay this out. Not everybody's parents and they understand this, but before the change, parents would find out that a child had COVID-19 in the classroom. They were given very limited information, just that they had an exposure. The child needed to be tested and quarantined. So this happened in my 7-year-old's class. She just went back to school 2 days ago. And we parents all started calling each other, talking, trying to contact trace to determine our child's risk. Like, how close were they to that potential student? But again, we're just kind of speculating. Do parents have enough information to make an informed decision and actually keep others safe?
And Melanie, what the story that you tell there is very, very common and very, very frustrating. And this has been part of the challenge is contact tracing, because this is being done through the Department of Health, which we all know is woefully underfunded and woefully understaffed throughout the state. And so it becomes very, very difficult. The process is taking too long. And it really does seem like this is the type of process that should be given to the schools themselves, because the schools can certainly understand where the child was, who they were exposed to much faster than some outside agency can. And then the parents can understand this much, much faster as well. And so right now, unfortunately, the way it's being done is it's delaying the process. And in the process, more and more kids are getting sick until the parents take it into their own hands to try to figure this out. So incredibly frustrating.
And I do have to say, my kids are in St. Johns County, and we had to make a phone call to Flagler County, and they were spectacular. They said they have so many volunteers that are trying to put these pieces together. But I mean, they're having to bring in volunteers, and then I'm also doing my own detective work. Now, you specifically have advocated for masks, despite the governor saying that mask mandates are unlawful. So just from that experience, do you think that districts will once again defy this new quarantine protocol?
Well, I think the districts, just like they have done with regard to the masks, need to discuss this issue with healthcare providers in their communities, public health officials, and ultimately come up with what they think is in the best interest of keeping our children healthy. Remember, we send our kids to school for an education, but we also expect them to come home healthy as well. And so the school districts throughout the state will continue to work to try to keep our children healthy, but in the process, help keep our community healthy. And whether that means that they're going to defy this new protocol is yet to be seen. But I have a feeling there will be a lot of discussion about that over the next few weeks to come.
And Dr. Joshi, thank you so much. We have calls out, though, to all of our local districts. So far, we heard back from Duval County. They said there's no change that they are planning for immediately. But again, we'll keep talking and get that information to you.